Well, good morning, everyone. And once again, welcome to another live, and hope you had a great few days of Christmas season. Michael, good morning. Andrea, hopefully I'm coming in loud and clear. Jerry, John, another Jerry. Good to have you on with us this morning. Nativity, good to have you on with us this morning. Donna. And John, our friend from Elgin, Illinois. Yeah, getting ready to do the restart. Are we going to do the reset on January 1st? Who's in? Okay, maybe we'll start on the 2nd. Maybe not on the 1st. Okay, bon matin to you, Steph, and good morning, Andrea. And Nick, good morning. Our staff is on, at least part of it. Donna and Leanne, Francis. Some people were asking me whether I was going to. Good morning, Kim and Maria, whether I was going to be on this morning. There's Jeanette. So staff is on this morning. Jeanette, good morning. And Jeanette, good morning. And Trisha and Glenna, good morning to you. Sandra, Micheline, Yolande. I always wait for Yolande. Annette, Pat, and good to have you on. So you know what we're doing this morning? Regina and Ram, Barry, and Susan, Lorraine, Sandra. You guys are great. Elaine and Sandra are doing the reset. Woo! And Diane, here we go. Okay, so this morning, Pam and Aline, Diane, I want to continue this series, and I'm going to read you a headline. I looked this up. It's pretty old. Where's my pen? There it is. I want to read you a headline, and then we're going to go. Good morning, Deb and Denise, and you guys are great. Etta and Angela. Okay, so we are continuing our series, the results of the low-fat diet, the low-fat craze. Really what it is, think about it for a minute, it's the counting of calories. So obviously not all calories are the same. But again, you got to go back to the history of this. Started in the 1950s. We sort of explained that with really one hypothesis brought to you by a doctor, a researcher. His name was Ansel Keys. Now, let me read you this headline, and then we want to go from here. And we see the shocking results of a lack of science, so-called science, but we see the shocking results. Let me just read this headline to you. I looked it up this morning. In 1973, the American Medical Association tried to suspend the license to practice medicine of Dr. Atkins. Okay? In 1973, the AMA tried to suspend the license, the medical license of Dr. Atkins. Who was Dr. Atkins? You guys know that. He was one of the first gurus that I studied under. And Dr. Atkins was a high-fat guy and a very, very low-carb guy. One of the first out in terms of where it really hit was in the 1970s. The American Medical Association literally tried to suspend his medical license. Now, this man was no dummy. He was a cardiologist. And by the way, I've said it in the past, I'll say it again. Dr. Atkins did not die from a heart attack. Okay, he didn't die from a heart attack. He was coming out of his cardiology clinic in New York City. He slipped on ice, hit his head, never recovered. He went into a coma, never recovered. And he was 70, I can't remember, 71 or 72 years old, whatever he was. He was in his 70s. I remember that. Now, listen, the significance of this craze, of the low-fat craze, we talked about it. We really emphasized one organ. You were given an organ that is your gallbladder, and you use it or lose it. But I'm going to go into a little bit more detail. We talked about a few things. Just think about this for a second here, and it really is astounding. This is far worse than the virus. It's far worse for humanity. That's one of the biggest tragedies of the 20th century and now into the 21st. And that is, we got it wrong on food. We got it wrong on food, and it has been disastrous. Now, let me talk to you about one thing that you and I would 100% agree on, and that is much more problematic for society in general. And I know, I was just talking to my son-in-law. We're just talking about how things have changed and how fast the world has gone into a lockdown and whatever it is, okay? And we've all seen it with our eyes. It's incredible. But I emphasize this, what they're missing, what the world is missing is not the healthcare crisis of the virus. It is the healthcare crisis of a low-fat diet. That 90% or more of the population went for. They went for a lie. And what happened? We have, this is incredible, where we have diabetes coming out both ears. It's worse than anything else because it's connected to everything else. We have diabetes. What are they saying now? 1 out of 3 are diabetics in North America. 1 out of 3. But like I've taught you over and over and over again, diabetes is the last thing that's going to happen to you. I was talking to someone on Saturday, I think it was. And I was telling him, because he was telling me, well, Dr. Martin, my blood sugars are good. I said, I don't care. I don't care about what your blood sugars are. I really don't. Because the last thing to happen is when your blood sugars will go south. When you have high blood sugar. That's not the first thing to happen. Diabetes happens way before they diagnose it. If someone, I found out now I'm a diabetic because my sugars have gone over, let's say 7. No, you were a diabetic years before that. You just happen to have an enormous, your pancreas has an enormous capacity to secrete insulin. But what causes all of this is insulin resistance. It's your cells finally getting so sick of insulin that now you become a diabetic. But way before that, is this pre-diabetic thing. We don't talk about that enough. And the world, I'll tell you, bring me I'm very observant. Bring me to a mall with you, okay? Now we're all shut down, but when it's open, I will tell you almost 99% accuracy who's sick and who's not. I'm serious. I look for bellies, even skinny people. Don't mean they're healthy. They just don't make a lot of fat cells. See, your body's reaction to eating a low-fat diet is fat cells. Low fat. People just don't understand that. They can't see the concept of it because they look at fat. I'm telling you the other day about that steak I seared, and you see that white film afterwards. And, oh, that must be bad. No, that white film will be oil in your body. It's sugar. It's carbohydrates that will turn to fat. Carbohydrates turn to fat. I don't care if it's whole wheat, triple wheat, 12 grain, 17 grains, grains. It doesn't matter. It will be sugar, and sugar will be fat rapidly. Where especially? Where? In your liver. So the first step, it has been a dramatic shift from the 1950s and even in the 1960s. People were small. And the biggest reason that they were unhealthy, the biggest, I mean, there was very few diabetics. There were some. Well, we have a whole industry. Do you think for 1 minute, think about it. If you are the CEO of Pfizer or of whatever, do you think for 1 minute you're looking for a cure for diabetes? No. You're looking to manage diabetes. And thus, you get all these drugs that come out, from metformin to gluburide, and all these new, they're all, metformin's an older drug, but they're all made to keep diabetes, to manage it. They pump out sugar out of your bloodstream, something that your pancreas is supposed to do from insulin. All these medications. And what they need is not a medication. What they need is a diet change. They got to go high fat. It's not calories. It really isn't. A calorie is not a calorie, calories, don't even think about it. That's why most diets fail. They're based on calories. They're based on faulty mechanism. So what do we have in our society today? Well, you can live without a gallbladder. Okay, you should have a gallbladder, but you can live without it. That's a tragedy, though, by the way. This diet caused us, especially women, to lose their gallbladders and to develop stones. But the main tragedy has been diabetes and pre-diabetes and obesity. We've developed a couple of generations now of obese people. And I've shown you in that book, in our book, the metabolic reset. I talk about it. I said, what does this diet, this low fat, have to do with everything? Everything in medicine. It increases your risk of cardiovascular disease. Cardiovascular disease would be almost eradicated if, people stop smoking and ate eggs, meat, and cheese again. It'd be eradicated. We wouldn't be hardly talking about it. It would be about probably 10% of the population. Today, it's 50, 60, 70% of the population have cardiovascular disease. See, cardiovascular disease doesn't happen in a hurry. That's why it's because people don't think. They don't think. They think, what I ate yesterday has no effect on me today. Yes, it does. It creates a cascade of problems, and cardiovascular disease is caused primarily by sugars, crappy carbs. All of it, from high blood pressure to atherosclerosis, hardening of the arteries around the heart. Because we don't eat enough fat. We eat the wrong fat. We eat the omega-6 fat that is found in your crappy carbohydrates. You get a double whammo with a bad carbohydrate. You get crappy oil, and then you get crappy sugar. It increases your inflammation, changes your Teflon layer of your blood vessels, and you start getting hardening of the arteries. I remember reading articles 25 years ago, 30 years ago even. Kids with atherosclerosis, hardening of the arteries, children. You see a child with a belly? It's a sugar belly. They're already starting the cascade of symptoms. So cardiovascular disease, cancer. We have today, and I got to breathe, okay? Because Rosie has one of those smart watches. I don't want one. You know why? Because it's always telling people to breathe. I don't want my phone to tell me to breathe. No, but seriously, because when I think of stuff like this, cancer, we haven't won the war on cancer. It's all nonsense. When we think, the advancements in cancer, there's been some advancements in cancer research. I admit that. But generally, we're not getting the big picture. We're looking for love in all the wrong places. You go get a PET scan. A PET scan's not for your pets. It's a cancer test. They give you sugar, radioactive. And you'll light up like a Christmas tree wherever you have cancer if you get a PET scan. It took us years in our hometown to get a PET scan. The government didn't want to fund it. It's one of the best imaging that you can get for cancer. Much better than an MRI. Much better than ultrasound or any of it. But they're expensive. The advancements in cancer, I like that PET scan. I do. But how does it work? Sugar. Well, hello. And then I go tell doctors, hello. Well, sugar, that's not a factor in cancer. Jeepers creepers. What? But when you're ignorant in nutrition, it's hard to change people. But the results of the low-fat diet, the results have been catastrophic. Catastrophic. Guys, the proof is in the pudding. Catastrophic. Diabetes. When I hear somebody has cancer, this is me, okay? This is me. When I hear somebody has cancer, any kind, you know what I say in my head? You got to understand how I think. You know what I say in my head? Well, they're a diabetic. What? Well, they might not be diagnosed with diabetes, but they're a diabetic. Now, I understand in cancer there's environmental things, and we live in a different world today with 100,000 new chemicals since World War II and all that. I understand all that, and there's an effect on that. But you can't control that. Where are you going to go live? In Costa Rica? On your own? No, come on, you can't control everything. There's chemicals everywhere. Oh, when I think of these people using every minute of every day. Oh, I saw it when I was in the store the other day. They spray the counter, and they spray, and then they clean their hands 75,000 times a day. Oh, with these antibacterial. Oh, that's cancer in a tube. It's cancer in a tube. I hate that stuff. The virus, the virus, the virus. Yeah, I see people walking around with a mask, and I'm not kidding you. I came out of the grocery store the other day, and a lady had her mask just over her nose. It looked like, I said, well, geez, was she from outer space or something? But you know why? You know why? Because she was smoking. I felt like going over to and say, ma'am, can I talk to you just for 5 seconds? Why are you even worried about the virus if you're still smoking? What's worse? Oh, guys, I'm telling you, see, if I had that phone on me, it would be telling me to breathe. I don't want that thing beeping. But think of where we are today. The fat-free craze. And by the way, you should have seen this lady's grocery cart. Now, I don't mean to judge. I don't. But she was very unhealthy, and then she's smoking, and then you should have seen her grocery cart. 99% carbohydrates and junk. And whole wheat bread. Oh, I always laugh at that. Oh, it's whole wheat, Doc. I don't care. It's going to be sugar in 5 seconds. I don't care if it's whole wheat. So what have we seen? Well, I'm going to name you 3 cancers that have just exploded since this fat-free craze. Colon cancer. Colon cancer. I'll tell you, when sugar gets into your gut, it messes up your microbiome. It feeds candida in the gut. And I'm telling you, one of the it is for, and in young people, getting colon cancer today is a direct result of the low-fat craze. Now, I don't know if you've heard that anywhere else, but you heard it here. Number 2, pancreatic cancer. Used to be rare, not rare anymore. Not rare anymore. Why? Fat-free craze. Third, did I say 3? I meant 4. Ladies, listen. Listen, ladies. Breast cancer. Breast cancer. Sugar. 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 Plus estrogen. Sugar plus estrogen, disaster for women. We haven't even made a dent in breast cancer. You see, because all they're worried about, here's medicine. God love them, but here's what they're up to. Mammograms. And let's find cancer. Okay. But how about we start cancer prevention? Let's prevent cancer. But it's detection. The PET scan and all. I'm not against it. All I'm saying is we got to get it way before it's there. Breast cancer is a growth as a direct result of estrogen and sugar, carbs. It takes 2 hormones to get a cancer, a breast cancer. And men, we're no better. Prostate cancer. In the 70s, breast cancer, you know what it was? 1 out of 20 women in North America. 1 out of 20. It's 1 out of 5 or 6 today. Whenever I get in a room and do a seminar with women, I count. I go 1, 2, 3, 4, 5, and I'll go up to 6. 1, 2, 3, and then I say, you see you ladies here? You see you ladies? One of you is going to get breast cancer, according to the statistic. But let's reverse engineer these things and find why? Why so much? Prostate cancer in men. How does that happen? Estrogen instead of testosterone. See, men battle from an early age to keep their testosterone levels optimized. Most men, they hit about 50 and their testosterone, their wives have more testosterone than they have. Plus, they got more estrogen than their wives have. Do you know how many times I've seen that? They got no more testosterone left. And when you don't have any testosterone, men, there's a hormone waiting to take that place. And it's called estrogen, the womanly hormone. And it makes things grow. And they'll grow, your prostate. And breast cancer, ladies. Hope you don't mind my singing. But you see why I got gray hair? Cortisol, stress. No, guys, I just when I see the stupidity of our world, I hate to be negative, but my word. Like I said, it's crazy because we have now the sickest population. North Americans, 88% of North Americans, not according to me, because I think it's above 88%. But let's give the CDC credit and the National Institute of Health, where it first came out, they said 88% have metabolic disorder. But if you have metabolic disorder, you're on your way to cancer, heart disease, Alzheimer's. And I'm not... Guys, can I say something just... Well, it's my show. I'm going to say it. You know this family history? Boy, that was a big thing. That was a big thing. In medicine, even today. They can't get that. Oh yeah, but my dad. Look, diabetes is coming out both my ears, genetic-wise. I've told you this a lot. I even look like my father. Kind of scary in a way. You never have to, I don't have to worry about who my parents were, believe me. I look like my dad at this age. My dad was a diabetic. I understood that way back in the 60s. I got the memo. Me and sugar don't get along. You know, some people get away with it a little bit more, but they get other issues. Yeah, maybe it's not diabetes, but they get cancer. They get cardio. And you go, yeah, but my dad had a heart attack. Yeah, okay. That makes you a little bit more susceptible, maybe 5%. I give 5. It really is a little bit less than that, but nobody wants to talk about that. Oh, we're just going to put you on statin drugs because your dad had a heart attack or your mother had a heart attack. Yeah, but it only makes you a little bit more susceptible. And you can override your genetics. With what? Diet. Somebody asked me the other day, Doc, what's your expertise? I said, food. And they're looking at me, well, there's no doctors in food. I said, there are not many of us. I'm a doctor of food. Yeah. You can't control everything in life, but you can control what you eat. You can control what you eat. Oh. See, I got my workout. Okay, so here's look, I could go on, you know. I could go on about other factors. I'm just wondering if we, you know, one of the biggest things, did I talk about this the other day? I can't quite remember. I talked about, you know what's a major scourge today due to our diets? It's kidney disease. Chronic kidney disease. Kidneys really, really don't like sugar, you know. They really don't. Your organs don't like sugar. They love fat, but they don't like sugar. They don't like the bad fat, but they like good fat. Eggs, meat, and cheese. Why did Dr. Martin always talk about eggs, meat, and cheese? I do not negotiate with terrorists. I don't negotiate. Eat eggs, meat, and cheese. And trust me. Why? Because it's what you're meant to eat. You need that healthy fat because it doesn't turn to fat in your body. It lubricates. It takes inflammation out of your body. What do we see so much of? So much of because of our diet today. We see kidney disease. We see fatty liver. We see heart disease. We see cancer. We see Alzheimer's. What it does, the fat-free thing, we could spend a whole week talking about the effects it's had on the brain. And Alzheimer's and dementia. Not getting enough cholesterol up in the brain, and your brain needs it. Anyway, okay, let me stop pontificating. Okay, now we got some good things coming here. A couple of new studies. Oh man, oh man, oh man. A couple of very interesting studies that I flagged and I want to talk to you about. So we'll go into that, okay? Now, a couple of housekeeping. Get your friends and your neighbors and your family to join the Martin Clinic private Facebook group, okay? A great group, and we thank you for that. It is thousands upon thousands of people. We thank you for that, okay? Get them to join. Secondly, this week it'll be Thursday because of the New Year question and answer Thursday coming, okay? It'll be Thursday that we'll have question and answer again. We really enjoyed all your questions. Don't be shy. Ask your questions. Give us your comments. We appreciate it. We really do. Be nice. But listen, you might not agree with everything that I've just said. That's all right. I love you anyways. I mean that. I'd still love you. I heard a radio talk show. The guy said, I'm right, you're wrong, and it's settled. I kind of like that. Okay, love you guys. Talk to you soon.